So I asked Mara about her medications and medical conditions because specifically that baby aspirin that she takes will cause her to bleed a little bit more. So I'll have to hold pressure a little longer just to avoid some bruising on her.
Perfect.
Nothing on the lower face. Or we've done your DAO. Do you want to do that again?
Yeah, we can.
Make a frown for me. Okay, yeah, we will. You can rest.
Perfect. So as you've seen Katie cleaning, we want to clean, clean, clean until there is no makeup on that alcohol swab and everything in between. For this is just safety for the patient, right? We want to make sure there's no risk of infection. These are low infection risks, but anytime you have some germs on the skin or anything that would be unnatural to the tissue plane, we want to clean up and address. So next phase is going to be marking. I think marking is always going to create the highest level of success consistently.
Make your angry face for me.
So let me ask you this. Do you really think this is the tail?
Which one?
Medial, lateral? That seems more medial. Make an angry face. So she's hard because she's already hit so much here.
Sorry.
But like if she was, I mean, I wonder if you pulled up old pictures of her making the expression
It
before
probably goes further.
It's way further,
Okay.
right? So angry? Maybe
No,
a little
I see
tissue,
it.
but see
Okay.
how wide she is?
Yeah.
So that's definitely, I mean, you're going deep here. So those are the things I want. She's a little tricky because she pulls like, she doesn't move a lot.
Can you do that one more time?
Really hard.
So like maybe
So
this
I
is
think
actually
like there,
the end.
I
Okay.
do.
And you
But
can
you know,
relax.
I don't think, you may not have to go all the way here, but I definitely think I'd go a little more lateral.
Okay.
The thing with her, she's so frozen in these areas, she's not going to be probably that bad no matter what. So I think by
And I'll
deadening
inject
this and
right
this, you're
above
probably going to
those.
deaden the lateral tail. That's perfect. And that would kind of come deep to that, deep to that. I'm sorry, not deep, but superficial to this. As we know, this last time she cut the levator, so we just got to like bleb it laterally. Okay,
Perfect.
so that's good. Now here's a good option for you. This is good. Raise up on the brows. So see where the animation's more low. This is where actually these are good. This and this is good. I might drop these down more where there's a little animation.
Right there.
Now remember, we got to be cautious now because we're going lower on her, right?
Right.
So this is where we just got to be observant. The lower they go, the more she can drop, right? So it's just like the softer distribution might be the best way to do it. Raising the brows one more time. And, you know, she definitely gets some activation here. So are we bringing these a little more medial to catch the middle, or are we actually going to do another dot here that might help soften?
Raise up. I'm going to do another dot.
Yeah, right there. There we
And
go.
then I kind of want to do those upside downs, just a sprinkle. One more time, raise. Because that will target that and that.
For sure. I agree. So what I might say is do this. So then if you're going to do this one, I might bring these a little higher up.
Okay.
And then I might bring this one a little more medium high.
Okay.
Right? Because the biggest thing I'll tell you is we start playing low to that line of conversions
And they're gonna get heavy.
She might feel heavy.
Okay.
Even though I don't think she pushes heavy. Does that make sense? So, but then I would do that one. That's perfect.
Okay.
Does that make sense?
And honestly, all four of
Honestly, I
those are
do.
going to be super light.
And then put this in between the two. So make sure it's just evenly. Because remember, if I get too close to this is going to get distribution, and that's perfect, right? There you go.
Okay.
That's good.
Raise up your brows. Yeah, I like that.
And she's frozen here with Botox already.
And
so,
this will
yeah.
distribute to that little low line
Exactly.
there, and this
Yep,
will distribute as well.
100%.
And then raise up one more time for me. So we've low spocked before, but I think that's why you weren't able
But-
to get the maximum lift last time.
But we want to lift her, right?
Yeah.
So
So
that's
this
the
time I'm
thing.
not gonna
So
low
I would
spot
go
her.
1, 2, 1, 2, and let's see if we can actually raise her brows.
And then one other thing that we've done differently in the past is we've done a high, but raise your brows. I see no movement
I
up
would
there.
leave it.
I don't want to touch
I
it.
would leave it.
Okay.
Yep.
Big cheesy smile for me. Beautiful. So we're going to go here, 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 and then I'm going to go 1 and 2.
There we go.
And then relax and cheese for me one more time.
So watch her smile. Smile. So
Like cheese smell?
cheesy smile. Okay. And then squint your eyes in. So this is where I get inferior. This muscle pulls that way.
Yep.
So you're not like, does that make sense?
Yes.
So it's the pull here. So smile big. See that pulling?
Yes.
So if I deaden here, it's going to stop the crow's feet. There you go.
And then just keep it on this side. So
And then
same. So
cheese
where
in.
I was originally
Yes,
was
actually
I
better.
always just feel like that's so low to the zygomatic, like to the major.
You actually won't. The thing is that I've never dropped it, knock on wood.
Okay.
I think people drop it when they're going too low here.
Got it.
Because it branches and attaches here.
Yes.
And it branches and attaches
And it
here.
would, yeah.
If you're staying here, you're fine. If you start dropping this lower
Well,
here,
especially if my
then you're
needle's
gonna
going
drop it.
inward.
Exactly, right?
And then
So
am I even there?
that's what I'd say.
That one. I just
Yeah.
like to also make sure it's even. Perfect. Frown for me. I
Feel that pull?
actually
Yeah.
feel like it needs to go upward a little bit, but
Okay.
I'll use the marking
Remember
as
that
my guide.
triangle's
Needle will
off.
go right in between. Yep.
Triangles off. There you go.
Perfect.
Perfect. Okay. So I would really like play with Mara is like 10 to 12.
Okay.
Sprinkle, 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 sprinkle. I think her muscle is going to soften, but I want to really maximize her brow lift. So if we can get the brow lift really nice, that's amazing.
Okay.
Right? So
should I almost start on the 10 to 12 up top?
let's do it. I know. Love it. So there you go. So I would maybe start in the forehead if that's the one area you got to be the most observant.
I kind of want to.
If I want 10 to 12 units, how many is that? That's 0.1,
0.3 here.
0.3. So I'd go for 0.3.
Okay.
So if we have 1, 2, 3, 4, 5, 6, 7, 0.3.
Do you feel comfy?
So 3, 3, and 1. That. So 0.05 almost on everyone except that last little touch. Does that make sense?
Which I'm going to do that one in the low middle.
Yep. There you go. Perfect. So
I'm gonna lift her just a
0.05, 0.05.
tad.
There we go.
And you feel comfy there? Mm-hmm. Do you need anything from me? We're going to start on the forehead, okay?
If she doesn't bleed, I want you to go boom, boom, boom.
Okay, just
I
go
only
right
want you to
into it.
pause if she's bleeding.
Okay.
So let's try that.
Boom.
There you go. This is just going to create a little efficiency. Touch. And we're going to go low. Touch.
Good job, you're doing great.
Perfect. And then that, yeah. Touch. And the lightest little touch there. The only other thing I'd say, if you don't mind,
Please.
hold back.
Yeah.
And then go in.
Got it.
This is going to pull
I
her
wasn't
taut,
taunting as much.
because you're not taunting.
Okay.
So she's probably going to feel it a little more.
Okay.
Good. Perfect.
Sorry
Good
if
job,
you are
girl.
feeling a little spicy. And then so now I do have 0.3, which is, I'm going to be a hair short on here.
Yeah. So what you could do is maybe do like drop, drop, and then hit these two.
Okay.
And then, you know, boom, boom, and then her eyes.
I like that.
For my mind, if this was me, right, I would say 10 here. So most of my distribution is going to be eyes and 11. So in the eyes, I just want to make sure I'm really dominating the brow lift. So what I'd say is finish up with this. So I try to maximize either the 11s, knowing we're going to really hit the eyes with 25 units, knowing it's maybe like 2, 2, 10, 10.
Okay.
Or does that make sense?
Yeah.
So I just want you to think like, where is this going to be best?
Perfect.
Actually, maybe you save this for the eyes and
I
this,
think that might
and
be a
then
good
focus on the
split.
glabella.
Yeah.
Does that make sense?
Yeah.
Okay.
I'm going to do that
So,
there.
because if we have 10, 15, and we can do 20-ish,
Right.
we're sitting really good.
Right.
So there we go.
Quick
So that just barely under. Perfect. Never want to go too deep on that one. Perfect. And go instantly to pinch.
Oh yeah, sorry, you're right.
Yep.
I do. Quick poke. So basically you're trying to
There you
make
go.
it so I stop
Perfect.
too much.
Yes. Okay, now this is where I want you to turn her and then really kind of come across her so you can really angle it that way. That's
Okay.
perfect. Beautiful positioning.
to the belly.
Way better. Do you see that difference?
Yeah, it feels
You're
better
way
too.
steeper. There we go.
Perfect.
Now, sometimes, here's another thing I know I'm throwing a lot.
it's
If
okay.
this is a 0.1 and you don't have a ton left, I might do the 0.1, 0.1, and then I have 0.05, 0.05.
Okay.
So hard hit, softer, softer.
Okay.
So just pay
So
attention to
that
how much
means
you
you'll
have
go
left,
ahead and
right?
go that
So maybe
way.
go to this one.
And I'm gonna
Yep, that's
hold
perfect.
that
Great job.
way, deep to the belly.
Perfect. Beautiful.
Good
Great job, girl.
Mama. I know, I'm sorry.
Then just one of these. I think actually it'd be fine if you do half of that.
Right.
Go tut,
That's what I
and
was
then do
thinking,
everything
too.
on this.
Yep. Sorry.
Sorry.
I dripped on you a little.
Yep.
Thank you for telling me.
my own
And then
Good.
I'm going to have you come my way a little bit.
Yep. Pull tight and just blab. This is the one. Perfect. That's beautiful. Good job on that one. There we go. Then we'll go to the other side.
And then go ahead and turn Trevor's way.
Yep.
Perfect.
And then yep, there we go. Perfect. Switch.
Okay. Her eyes are closed.
Yep.
I know I don't like to switch my needle
You
in
might need
front
to
of me.
flick that.
Okay.
Air bubble
No
it out.
problem. Thank
Okay.
you for telling me.
There we go. Good job.
You okay, Mama?
Good job.
Itchy.
So if it was me, and before the eyes, I would maybe
I'm gonna
just
do
knock your
DAO,
DA out
yeah.
and then go
'Cause if
to the
not, I'm
eyes.
gonna forget.
Yep, then you might forget, as I do all the time.
I'm going to have you animate. I like to do that on my lower face one. So if you don't mind, make that frown for me.
There you go. Perfect.
job.
Good job.
All right. Now
All right,
we're going
then
to
you
do
can
around
rise.
your eyes so you can lean that way. I'm going to lift you up just a little
Beautiful.
bit.
Amazing.
These ones I like to be like in.
Very
Thank
good.
you so much.
Very good.
Okay, these are going to be spicy, Mama.
Yep, same thing. So hold, tut, 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 tut. As long as she's not bleeding, you can kind of just balance it. Good. Good. And you got 3 more to distribute. I keep this one a little more. Higher units to lift, right? And then touch, touch, softer.
You're doing great, Mama.
And then just the littlest one that's
Last
inferior.
one.
There we go. Perfect.
Good
okay.
job.
Good job, girl. So see, we always want to open more than drop.
Right.
So I'm always going to do more units high than low.
Because I feel like it's like a 0.6, 0.6, 0.4.
Yeah.
All right, and I'm gonna have you lean this way just a tap. Perfect.
There you go.
Quick poke here.
So think touch, touch, touch. If it bleeds, then you pause. The only time I'm wiping if it's bleeding. Unless it's in a different area.
Right.
I always stop at this area to go to the next. And that's the one thing. We'll always let them stop bleeding if they are before you always go to the next
Right,
area.
because we
So,
don't want blood dripping down on them.
You don't need any of those issues.
Last one, Mama. You did great.
There you go. Good job. Beautiful.
Yeah, good job.
And then just when I clean her, we'd clean and wipe away, wipe away. That's a little like kind
On
of
the
like,
eyes, that's the one that I'm like, do I wipe in a circle upward?
I just always up and away, up and away. Yep. So we're gonna like, and I massage a little bit because I'm like forcing product up and away, up and away. We never want to go down with it. There we go.
Okay.
Feels so
Up and
good.
away.
I figured. I just
Up and
wanted to
away.
make sure.
So this is why I always like to do this because I'm going to help distribute product
Right.
before they
Less bumps.
Right? Exactly. And then on that, yep, up and away, up and away.
Okay, kinda like
beautiful,
that.
just like that. There you go. And same there. And then I just whoosh, out. Never pushing it toward the area we don't want it
Right,
to.
because
And
if
then
we
just
push
allow
it into the eye.
And then I always like to dry them, make sure they leave. Because remember, what does alcohol do? Makes
Blood
you bleed more.
thinner. Yep.
So,
Especially in Mara.
yeah.